Okay, welcome everybody to the Civil Society Draft Calls to Action for COVID-19 webinar consultation hosted by the Civil Society Engagement Mechanism of UHC 2030. Before we begin, I just want to provide a few instructions. We have sign language interpreters available for people who need them. To allow the screens of the interpreters to be up at all times, I'm going to ask that everybody who's signed in as a participant take off their video for now, so that the only videos that we see are the sign language interpreters. You hopefully will be able to see their videos right now. They're signing as we speak. If you would like to pin their video so that you can only see them and not my icon or the speaker icons while they speak, what you have to do is you have to find their video and then you hover your mouse over their video and you're going to see a pin icon. When you click on the pin icon, it's going to lock their video so that you only see them and then the slides that I'm going to be presenting. If you have any issues with this, please have somebody type maybe in the chat and I can try to troubleshoot. Otherwise, we may need to find a better platform for sign language interpretation in the future. And thank you for your patience if this isn't the ideal platform for this one presentation. So with that, I'm going to just hand it over to our presenters, Johannes Trimmel and Katie Husselby.
Yeah, hello everybody. Great to see so many participants having joined already. My name is Johannes Trimmel. I'm working with Sightsavers as a program director for disability inclusive development, and I'm a member of the advisory group for the civil society engagement mechanism. And I will kind of lead you through the first half of the webinar. And Katie, you might want to introduce yourself.
Thanks, Johannes. Hi, everyone. I'm Katie Husby. I coordinate the Action for Global Health Network, which is based in the UK, and also sit on the advisory group for the Civil Society Engagement Mechanism.
Yeah, so for this webinar, there's basically three parts. And the first part is to provide a bit of a background on what UHC 2030 is, what the civil society engagement mechanism is, what's the mandate and main activities, as not all of you might be really familiar with it, so that everybody kind of understands and has a chance kind of to see what we are and what we are doing. And then in the second part, we are focusing on the civil society draft calls to action. That's the main kind of point for this webinar today, and to talk about the audience, the purpose, to give an overview. And we aim at having sufficient time in the webinar then for discussions, for your input, for points that you find important to take up in these calls to action, which are currently in draft form. So we are coming to the background, and very briefly about what is UHC 2030, so Universal Health Coverage 2030. It has the mandate to provide a multi-stakeholder platform to promote collaborative joint working in countries and globally on strengthening health system and work towards health for all, and establish universal health coverage. And it also has the mandate to advocate for increased political commitment to universal health coverage and facilitate accountability and knowledge sharing. That mandate basically is also reaffirming that to achieve universal health coverage and to work towards it needs a sound and solid political commitment. So some of the mandates that UHC as a platform does is to strengthen the multi-stakeholder policy dialogue and coordination of health system strengthening efforts in countries, but also to improve coordination on health system strengthening efforts for universal health coverage at global level. It's also meant to facilitate accountability on progress towards universal health coverage, and as said before, to build a political momentum around a shared global vision of universal health coverage. And of course, not least, it's also working to advocate for a sufficient, appropriate, and well-coordinated resource allocation to universal health coverage and to building up strong and reliant health systems. UHC 2030 is hosted by the WHO and the World Bank and has a steering committee that provides oversight and makes decisions for UHC 2030. And in this steering committee, there are around 20 members from different stakeholder groups. So we have multilateral organizations, the World Bank and the WHO as hosts, philanthropic foundations have one seat, the private sector has one seat, and civil society has 3 seats, basically kind of representatives of northern NGOs, southern NGOs, and community-based organizations. And then there's also 3 alternative civil society representatives. And historically, there have been 66 partners in this whole Universal Health Coverage 2030 platform, including all sectors, also academia and media, which are actually not presented in the steering committee. And there's also a chance for your organizations to join the Global Compact on UHC 2030. So how is civil society organized in this UHC 2030 context? So basically, I already have said there's 3 representatives and 3 alternate representatives on the steering committee who are representing different constituencies in the civil society. But definitely that would be much too less and too few to kind of really kind of be representative of civil society voices. So to enable this kind of broad civil society input, the civil society engagement mechanism was set up, really meant to raise the voices of civil society organizations in Universal Health Coverage 2030. And with a specific, I would say, mandate or focus to really push and ensure that policies towards universal health coverage are really inclusive, are equitable, and that nobody is left behind. So activities of the civil society engagement mechanism include, of course, influencing the policy design, lobbying for participatory and inclusive policy development, to strengthen citizen-led accountability mechanisms, really also to promote coordination between civil society organizations and platforms across different levels from local to global, across different kind of specific interest groups in the health sector, and also to kind of build a momentum around creating a joint knowledge base and a joint force on what's happening at national level, what needs to be done, what are priorities, actions that are important in the perspective of civil society organizations. So the governance is kind of set up in a way that there is a membership, and each kind of any civil society organization that engages in health can join. So up to now, we have in our membership over 850 organizations from 100 countries, represented by over 1,000 individuals. And so that's the broad basis that we are working with and reaching out to. And then there's an advisory group of which Katie and I are members, which is composed of 18 members, including the CSO representatives and the alternates on the steering committee. And these 18 members are kind of are selected based on an expression of interest process and really looking at as much as possible representing a diversity from civil society across continents, across gender, across different backgrounds, etc., etc. So that's a bit introduction around what UHC 2030 and what's the civil society engagement mechanism. I would now shift to tell you a bit about how the draft calls for action were developed. So just to be very clear, is these calls for action were not kind of a new invention and kind of came out of the blue and just two people sitting somewhere and drafting a nice document, but they're really building on the work that has been done by the civil society engagement mechanism and probably by many of you over the last couple of months. So many of you have been involved in the civil society priority actions that we developed for the high-level meeting on UHC end of last year, where over 300 civil society representatives provided inputs. And it's really kind of was a process via interaction, webinar, and so on to kind of get to these priority actions for the high-level meeting. We did a survey on civil society participation in the COVID-19 response, and also in partnership with the Social Participation Technical Network of UHC 2030, we conducted an in-depth research on civil society participation in country level that resulted in a commentary that was published in the British medical journal Global Health. And we also kind of used the data to inform the civil society calls for action. We, of course, also looked at the key asks from UHC 2030 and related our draft calls to action to them, so to make them meaningful and kind of highlight specific points that we think need strengthening in addition to what's already put up in the key asks. And we also looked back at the political declaration from the high-level meeting on universal health coverage that also contains quite strong messaging that we want to make sure is not forgotten. And certainly when we put the draft together, we also looked at what civil society organizations at that time already have produced, have communicated and published, so to kind of get the depths of what's there, but also to be sure kind of we are covering issues in our draft calls of action that are of importance and priority for civil society organizations. So we were kind of moved fast and had to move fast to kind of publish these draft calls. But right from the beginning said to all stakeholders, including UHC 2030 and the WHO, that this is a kind of a first draft, but we will hold further consultations with civil society organizations, and we will develop these calls for action along the time. Also, I think acknowledging that, of course, the situation on COVID-19 response strategies, mechanisms, and policies is also changing over time, and there will be different phases where probably we also need to kind of highlight some actions more than other in the long run. So we now have this draft document that you have got, and the webinar today is one of the elements to kind of get your input into this draft document. And in addition, we will also set up an online discussion forum so that we have various ways on getting your input, your feedback, and your priorities to make our calls to action even stronger. And with that, I think I'm handing over to you, Kathy, to present the draft calls to action.
Thanks, Johannes, for that really useful context in developing the draft calls to action. I'm just going to start off by briefly running through the audience and purpose behind pulling together this document. So in terms of the audience, we're very much hoping that this will be a useful document once finalised for civil society advocates from across the CSAM and potentially beyond, who focus on any particular health topic or disease area, as a document that reflects some of the priorities of civil society from around the world. In terms of its purpose, yeah, as I mentioned, it's meant to be a resource for civil society organisations to incorporate these calls to action into their own ongoing advocacy efforts as well at the national, regional levels, and particularly with an emphasis on ensuring that no one's left behind when it comes to the fight against COVID-19. I'm going to dive into the overview of the calls to action, including the 4 key themes that we've identified in pulling together this draft. The first is a focus on leave no one behind, so ensuring that COVID response activities are inclusive and accessible to all population groups. This covers areas from information and health promotion and making sure that that is accessible, to response stations being safe and accessible to all different population groups, national COVID triage, testing, quarantine, treatment facilities, kind of the full spectrum in terms of the COVID response, making sure that they're available to everyone. And also thinking beyond COVID, that there is then also continuous provision of other essential health services, covering the full spectrum of care that we would look at under universal health coverage, from promotion, prevention, and rehabilitation and palliative care as well. The second piece is around public health financing and financial protection. So I think most of you all know that in terms of those previous documents that Johannes mentioned, there's an emphasis on advocates encouraging governments to invest in health system strengthening towards achieving universal health coverage. And here we see the connection as obviously to countries being prepared and achieving universal health coverage so that they can respond to global health emergencies and pandemics like COVID-19. This means investing in health systems and in essential health services that crucially reach the furthest behind first. So linking to that first call to action around leave no one behind. Reducing financial barriers as well at the individual level in terms of access to quality health services, with an aim towards improving equity. And also at the kind of national government level, increasing public financing using some targets from previous documents. So the call for a minimum of 5% GDP on health spending by national governments, and also the Abuja Declaration calling for 15% annual budget allocation for health spending as well. And I think the framing of that call to action is very much around the cost of inaction being more than the investing in health. So even where we're seeing reduced fiscal space in light of COVID, making that case for continuing to invest in health up front. The third theme is a focus on health workers. This covers lots of different areas, from training and helping them to respond to COVID-19, briefing them on their rights, roles, responsibilities and risks from being a health worker responding to COVID, ensuring that health workers have decent working conditions, that they're remunerated appropriately, that they have manageable workloads, and then also from a mental health perspective, stress reduction measures, psychosocial support, counselling, and also condemning any kind of violence, discrimination and stigmatisation that we might see against health workers due to fear of the spread of the virus. Finally, the fourth theme is around engaging civil society and communities in the COVID response. So Johannes mentioned the Social Participation Network survey that showed there was low levels of civil society and community participation in national task forces. So we're keen for a call for civil society to be included in COVID responses at all levels, so national, regional, international, and also in short-term but also long-term responses to COVID, to ensure that vulnerable groups, that their voices are being heard and included. This also means mainstream gender perspective in all COVID response and recovery activities, and also crucially having accountability mechanisms that are created by governments in collaboration with civil society and communities, and within that accountability, disaggregated data. And finally, in terms of that last call to action, that civil society has freedom of association, peaceful assembly and expression, and that any restrictions that are imposed are not extended beyond what's necessary based on scientific evidence in terms of the impact of COVID-19. Before opening up for discussion, and we're really keen to hear from everyone on those draft calls to action and for thoughts on gaps and what we've missed, we just briefly want to take this opportunity to touch on the Access to COVID-19 Tools Accelerator, known as the ACT-A. This is a initial group of global health actors set this up, including the Bill and Melinda Gates Foundation, SAPI, Gavi, the Global Fund to Fight AIDS, TB and Malaria, UnitAid, Wellcome Trust and the World Health Organization, also with private sector partners and other stakeholders. It is a global collaboration that is aimed at accelerating the development, production and equitable access to COVID-19 diagnostics, therapeutics and vaccines. There are currently 4 main pillars, as you'll see on the screen. So a diagnostics pillar, therapeutics pillar, vaccines pillar, and a cross-cutting health system strengthening connector pillar. In terms of the final call to action that you saw on the previous page and civil society participation in the ACT-A, this is currently, I would say, a mixed picture. So we're seeing efforts to include civil society in the diagnostics and therapeutics pillar, and some initial interim civil society participation in the health system strengthening connector or pillar. And work is ongoing in terms of the vaccines pillar and having civil society and community representation in that group. So keen now to leave lots of time for discussion and hearing from all of you. We have got a few guiding questions for this discussion, which you should now be able to see on the screen. Obviously, as we said at the start, this is very much a draft call to action. And we're keen to hear from everyone to feed in terms of the challenges that you're seeing and that you're facing and collaborating with governments on their COVID response plans. Do these messages that we've shown in these themes, are they responsive to what you're facing? And crucially, what is missing from this list and where are the gaps? Also, how can civil society be a part of the solution to COVID as well? Also keen to hear how you're framing your COVID-19 advocacy, whether you've used any of these draft calls to action in your work so far and how much they chime with the advocacy that you've been doing. And also, how do you recommend that global mechanisms like the CSEM engage civil society in COVID-19 activities? So obviously the ACT Accelerator is one area, but also beyond those, what more can we be doing in terms of the CSEM? So at this point, I'm going to open up the floor to discussion. It would be great if people could raise their hands so that we can see who would like to come in on the discussion questions. I think it would be great to kick things off with the first question in terms of the hearing about the challenges that you're facing, and particularly if you see any gaps in terms of those draft calls to action. So I'll pause there, and if somebody would like to raise their hand to kick off the discussion.
So we have a few hands raised. I will ask, since we want to make sure that people can see the sign language interpreters, I ask that you please all turn off your videos if you have your videos on. Please turn them off and only use audio. That way people who need to see the interpreters can easily find them on the screen. If you need sign language interpretation to make your comment or ask your question, it's fine for you to turn your video on. We just ask that you turn it off afterwards. So I think I saw Daniela's hand go up first. So Daniela, I'm going to take the mute button off so that you can speak. Go ahead.
Hi, everyone. Thank you so much for the webinar today. It's been really enlightening. I come representing Trans International Health Initiative, which is a global thematic network focusing on fighting we as a team were hoping to share with you a few messages that could be used in the messaging to highlight along the 4 pillars in the draft call. So I'll go really quickly around them. So in the first call of action on leave no one behind, there is also an area that could be added regarding regarding corruption. So it would be important that governments ensure that everyone has access to COVID-related and other health essential services without having to pay bribes or engage in any informal payments, and that decisions regarding access to therapeutics, diagnostics, vaccines focus on equity and do not further impoverish already vulnerable groups.
Daniela, sorry to interrupt you.
Yes.
Daniela, sorry to interrupt you. For the interpreters, could you please get closer to your mic so we can hear you better? Thank you.
Oh, okay. Can you hear me? I can speak louder.
That's better.
Okay. Sorry about that. So I'll just quickly say that again. So in terms of call to action 1, from our perspective, we believe that it would be useful to say as well that governments should ensure that everyone has access to COVID-related health services without having to pay bribes or engage in any informal payments, and that decisions regarding access to therapeutics, diagnostics, vaccines focus on equity and do not further impoverish already vulnerable groups. In call to action number 2, which is about increased public health financing and financial protection, we believe it would be important to point out that when governments are relaxing their procurement processes, there is also room for corruption there, and it would be important as civil society that we keep government expenditures in check and demand accountability and transparency in all health investments. Government actions to mitigate the economic effects of the pandemic should also be anti-corruption stress tested to ensure that they're not vulnerable to fraud or to undue influence. In call to action number 3, which focuses on health workers, it would be important to brief health workers on their ability to provide information on it was important to provide information to health workers on whistleblowing protection. Health workers should feel safe and free to report any malpractices without fear of retaliation. And call to action number 4, which is about to engage civil society and communities in UHC implementation to ensure accountability. It would be important that as part of the important role that civil society plays in this regard, civil society can act as watchdogs and grant disbursement, hold health agencies into account, support budget tracking measures, and monitor procurement processes. There are already clear examples of civil society groups and social accountability playing a key role in monitoring IMF COVID-related payments, for example, and we'll be happy to share those. So this is from our end. I'm happy to share these notes with Katie and with all of you in case that's useful too. Thank you so much for letting me speak about this.
Thank you so much for these great comments. I certainly, please do share them with Katie, and I'll also type in the CSCM email so you can send them through there as well. But very helpful, and I've made a note of them. Katie, go ahead.
Thanks. Yeah, they're really, really useful comments, and please do send my way. Also wanted to flag some other comments that have been raised in the chat box. So Sarat has mentioned there has been very negligible or non-participation by government agencies in the COVID-19 advocacy or responsive plans. What is recommendations to make them an active part of the system, which is really useful and obviously a key priority for us in terms of that 4th theme and how we enact that at the national and regional levels. Peter has also mentioned that the communities have been, as has been mentioned, have been given very little space as they've been left in the response so far. And crucially, how can we move resources to grassroots organisations? And I think that point around sort of resource and resourcing to civil society as part of that fourth theme would be really important. And I know something that's come up so far in the discussions in the webinars with Dr. Tedros and the World Health Organization. So thanks both for those really useful comments. Eliana, I'm sorry, I can't see the hands that have been
No
raised.
problem.
I'm not sure
Yes.
who's coming
So I did see one hand has been up for a while, and I'm sorry if I don't say your name right, but Akaninyene. I'm sorry if I butchered your name, but maybe introduce yourself. I'm going to give you the mic and then make your comment or ask your question. Go ahead.
Hello everyone, my name is Akane from Nigeria, community-based health insurance, Okana. I've followed the discussion and I want to ask the first question pertaining to Nigeria. In Nigeria, we've been having issues of government trust with the civil society. And in many of government's activities, the civil society has not been carried out. An example is the COVID-19 pandemic that have so eaten deep into Nigeria. The government.
Sorry to interrupt you, Akinenye. I think it's probably better if you can put your question or comment in the chat box, because we can hear you very faded and the sign language interpreters cannot pick up what you're saying. So maybe use the chat function if that's okay.
Okay, can I try? Can you hear me now?
It sounds better for now.
Okay. I'm saying that in Nigeria, we've been having issues of government collaborating with civil society. There's been that lack of trust between government and civil society. That even in the event of the COVID-19 pandemic, government have not really carried the civil society along in Nigeria. Like forming a committee to tackle the civil society in Nigeria. Government have not included civil society in the committees. Like we have laws on how to procure things. In Nigeria, we call that Public Procurement Act, of which the government are supposed to follow in procuring things to tackle the COVID-19. And in that Public Procurement Act, there is a room for civil society to be part and parcel of the plan on procurement and the budget for the procurement and even procuring those items. But in Nigeria, it's not the same because COVID-19 pandemic came into Nigeria. Government are spending at random, and they're not even accountable for that. I'm talking. I'm saying that one at the federal level. Then when we come down to the community level, of which the impact is immense in terms of economic impact, the government have not done anything. People at the community level are suffering. The health workers at the community level are suffering. They're not empowered to tackle the COVID-19. They're not even prepared for the COVID-19 outbreak that is on the increase on daily basis in Nigeria. When civil society approach government, like in Nigeria, we form Nigeria Universal Health Coverage Advocacy Network that are supposed to partner with government to tackle the COVID-19. But government up to now have not regarded the organization or the outfit. Even when we have gone on radios and gone on TVs to get them to be aware of our presence, they've not recognized us till now. And we are still doing what we have to do anyway. We are still trying on our own to do our best. So on question number 4.
Okay, thank you, Akinyene. I think it's getting a bit difficult to hear you, but I think we got the main points. So I think your point about civil society organizations and civil society not included, for example, in the committees set up for COVID-19 response and so on. That's exactly what we also found out in the survey when we asked around civil society participation in the COVID-19 response. And that was also the basis for the article in the British medical journal Global Health. And it's a point that we are constantly also raising in the webinars and in interactions that we have in global discussions, be it with Dr. Tedros or on other platforms. And I think that's really a key point, also to make sure that not only in the immediate crisis response, but also in the recovery phase, we are not continuing to have a situation where civil society is left out. And there's also in the chat box a comment from Lizzie around that civil society organizations can add a lot of ideas of decision making, so can change the current global situation, and that civil society can turn things around for good by ensuring transparency and community acceptance. And I would say that's absolutely correct. And transparency and accountability are also kind of one of key pillars in our asks. Eliana, is there any more hands raised?
Yes, we have a few. So I see Grace Dubois wanted to say something, so I'm just gonna hand the mic over to Grace.
Hi,
Go
thank
ahead.
you for letting me speak. This is Grace speaking on behalf of NCDA, so I'm representing 2,000 different civil societies spread across 170 countries. Thank you so much for this really interesting discussion and chance to feed in on such an important document. It certainly echoes a lot of the work that we've been doing, especially with WHO, really trying to strengthen their responses and support member states. I think particularly thinking about people living with NCDs, we've seen that they're at really high risk of COVID, particularly at risk of becoming seriously ill or dying. And they do represent up to 22.2% of the global population. But despite this, in a recent survey that we've seen published by WHO, about 50% of essential health services for this population have been either partially or completely disrupted. So what we've been really encouraged about is seeing WHO really join in the call with civil society, calling for government to continue their essential services. I think that the strong voices that we've been seeing are calling for people living with to be involved in decision making. So really echoing with point 4 of what you've raised in the document. And just encouraging for people being lived to be included in that response, especially those with underlying conditions. A point that we'd like to raise in relation to your point 2 of increased public health financing is the role of excise tax on unhealthy products, and really using that as a way to make the increased budget sustainable for countries. But thank you for giving me the chance to speak, and happy to feed in the future and be part of this important discussion.
Thank you.
Thanks, Grace. Really, really useful comments. And I also saw that WHO survey that you were referring to with quite astounding statistics in terms of the impact on NCDs. And I really, really like the example that you gave in terms of involving people living with NCDs who've been particularly impacted by COVID in decision making and in those task force groups. So that's great. Also, just to pick up on a couple of comments in the chat box from Noor, who says in Pakistan, we're seeing various challenges, including lack of training about COVID, not having proper arrangements for prevention of civil society workers. Also, a question from Tara. It'd be great if we can hear from the speakers how we can improve CSO engagement within the COVID response and within global programs. The Director General was clearly asking for ideas on how exactly this can be improved in terms of innovations around VSO engagement. Completely agree. I was part of both of those webinars and also felt that call was coming through really strongly. So would certainly welcome ideas from those who are on this call, and certainly we're looking to capitalise on the fourth theme around engaging with civil society and communities. As I mentioned, the ACT Accelerator has been one way where we've been trying to do that, and also trying to encourage the DG to use their calls with national governments to speak up about civil society engagement in COVID task forces. And I think also there's probably more conversation that could be had around the role of WHO at national level, as well as the discussions we've been having with HQ. Floor has asked a question in the chat about exploring linkages with groups implementing social accountability, especially collaborative social accountability. I believe, Daniela, you might have some examples along that side of things in the questions you were raising around transparency and accountability. So it would be great to incorporate those. Lizzie's also said, in terms of the fourth question, CSAM targets primary health. This works well with countries. Yeah, completely agree. And Noor has said, in terms of the second question, that civil societies can network as they're existing in all geographical areas of Pakistan. Yeah, really love that idea in terms of networking. And finally, Catherine has added, we're working with palliative care patients and providers around the world to integrate palliative care into the response. We're framing our palliative care advocacy in terms of the need to improve resourcing and training for this neglected essential public health service, also emphasising the need for access to controlled meds, full treatment of both COVID patients and non-COVID patients with serious conditions. Completely agree, Catherine, and certainly we're keen, obviously, as the CSEM for Universal Health Coverage 2030, that the piece around health systems absolutely includes the palliative care aspect and the full spectrum of health services in terms of universal health coverage. Eliana, have we got other hands up?
Yes, I see that Mariska actually had her hand up. Mariska, I will just give you the floor. I know you typed something in the chat, but you had your hand up for a while, so I will unmute you now. Go ahead.
Hi, Eliana, thank you. Actually, I just typed my comment in the chat indeed. So everything I wanted to comment on the contents is there. I also wanted to make a comment on the process. So I was very glad to hear that there'll also be an online discussion platform and more opportunities to give feedback. And it was great to see the questionnaire that you did before, because I feel that, you know, no matter how many people we are here, civil society is so huge and diverse that it's a bit hard to state that this is a really representative call to action. So it would be good to also acknowledge in the calls that it's that it's one of the calls to action from different civil society constituencies, as there have been calls to action also on vaccines and other related health issues. So thank you for giving me the floor.
Great, and thank you for your comments in the chat. I do know also Peter Owiti has had his hand up for a while, so I'll just give Peter the mic. Go ahead, Peter. Yep, we can hear you.
You can hear me?
We can, yes.
Yeah, thank you very much. This is Peter. I'm from Kenya, and has been stated, the civil society has not been able to get more resources. When you look at the Global Fund initiative for COVID, most of the funds went to the government. And we know how government work. In most cases, the bureaucracy, exclusivity, and the political orientation, and therefore the response is normally not very cost effective. But the civil society has been left out of the response, and there have been a terribly high increase in COVID, particularly in sub-Saharan Africa. So apart from the initiative of the Global Fund and of course the money from the World Bank, which was given to government, there is need for civil society to directly get money and be part of the response, because they are at the grassroots, they are within the community, and therefore we might be able to get a higher impact. And that's why I also am very happy that we have the Act A coming in strongly with civil servant, the 6 civil society involved in all the pillars. So we need to channel the money to the civil society so that the government is very able to punish civil society when they don't use the funds well, unlike the other way around. When the civil society cannot punish the government as much. Again, there is the issue of the community of the health care workers. We hear that in most countries and here in Kenya, the community, the health workers do not have enough PEP, in spite of the funds being given to the government and also the government having its own funds. And of course, when we formed the SAM, the government were already struggling to meet the commitments of the universal health coverage in terms of human resource and in terms of financing the health systems. But now with COVID, it's now honestly going to be very, very difficult for the government, particularly when the healthcare workers are now also being infected by COVID-19. So it's really a situation that we need to come in strongly in the community engagement and make sure that we really put all our efforts together to respond to COVID and generally to universal healthcare. Thank you.
Thank you. Katie, since you've been looking at the chat, sorry, I've been taking notes on the comments. Are there any other comments you'd like to read out loud?
Seb, I wonder if you want to come in just with the comment you've added in the box.
Yeah, sure. Can you hear me?
Yes, we can hear you perfect.
Hi. Yeah, so it's just a question. Put my video on just if interpreters need that. Just a question around how UHC 2030 is planning to use the call to action, if you're going to do any direct advocacy, as well as kind of encouraging civil society to take up the messages. My reading of the call to action is it's quite, I mean, by its nature, it's slightly like top level. So, I mean, kind of community activists and civil society know what their priorities are and are already advocating for that. So is there potential for UHC 2030 to kind of flip the direction of uptake? So rather than asking community activists to use these advocacy messages, can UHC 2030 take on board? I mean, I know you're doing that in this process of consultation now, but can there be more of that and more kind of specific stuff? Or is there an aim to focus on more of the cross-cutting issues rather than the specifics? And I've put some kind of suggestions in that chat function about the kind of, as the previous person mentioned, kind of the like funding for the basic needs of food, shelter, social support, which a lot of like our partners are struggling with at the moment. So just a bit more information on how you plan to use it would be great. Thank you.
Thanks, Seb. Yeah, I think it's a really good point and challenge to us in terms of obviously the purposes we outlined was hopefully to use this as a way to identify cross-cutting issues that would then be useful in terms of that national and regional level advocacy. But I think you're absolutely right in terms of considering the opportunities of the reversal of that. I think with Dr. Tedros and WHO a wonderful opportunity where we could and should be doing more in terms of taking these themes that we've identified and feeding those in. So the CSEM are one of the focal point networks who are helping to pull together those webinars with WHO. So I think utilizing these cross-cutting themes, some of which you've added in the chat box and some of which are already there in areas, is a really good idea, and that we should also be looking for other opportunities for the CSEM to take these forward at the kind of global advocacy level as well. So thanks, really, really useful comment.
Maybe if I can add here, I think you're right, Seb, that the asks, of course, are at a certain top level, and so I think they are also meant for civil society actors at global, but also at national level to kind of provide a bit of a framework that's hopefully helpful. But of course, it means, as you say, people know what their priorities are and they can kind of contextualize and specify in their work towards government and response, COVID-19 response policymakers. I think on the question on how to get the voices from civil society, from communities up into global level discussions. So one thing that we have tried is to include people of CSO and community-based organizations in the global level kind of virtual interactions so that they can talk about what's their experience, what's their challenge, so that they are heard, but that can definitely be strengthened. And one of the real challenges that we know, and it was raised before, is kind of that there is a definitely lack of resourcing and supporting local level or civil society organizations to take up a more proactive role, be it in country, but also in contributing to the global debates. And that's a point where we are constantly raising. And I think here we can kind of use all the voices also of participants here in this forum to strengthen that call for supporting civil society organizations. And I think, unfortunately, as it's also mentioned in the chat, is so far that when it was not domestic funding but donor money, it very often was kind of provided at the very top level, often via multilateral organizations, and it's most of the time not including any provision for civil society. And I think that's also a good point to take up in our advocacy work.
Thank you. So there are a few comments in the chat. Can we switch over to the chat and see what people are saying? Katie, do you want to take over?
Sorry, I thought I had someone else coming in.
No.
Yeah, absolutely. So Noor has written in the chat box, at the international level and regional level, networking should be initiated. So I think connected to what Johannes was just saying, Global Fund should allocate funds for COVID as they've been doing for malaria, HIV, and TB. National level civil societies network should be initiated and strengthened after holding dialogues in various communities. So in terms of what Johannes was just saying about providing those cross-cutting issues for civil society organisations to come together at the national level, definitely hope that will be helpful. And hear what you're saying, Nora, in terms of the resourcing point when it comes to COVID-19 and resources for civil society. We've got another comment from apologies if I say this wrong, Akaninyane, advocating that aid given to African governments should have a condition for active participation of CSOs in the planning, implementation and evaluation process, right from the national to the local level. I think that's a great idea. The COVID-19 pandemic has shown us that the Africa continent government is not really transparent with data, how we're tackling the pandemic, which is on the increase daily. And it distorts the collective effort to tackle the pandemic. Being mindful, I think building on the comment from Grace earlier in terms of NCDs, being mindful of conflict of interest that arises with private sector engagement during COVID is something that needs attention. It's a really important point. The interlinkages between NCDs and COVID has been established. It needs due consideration. Unhealthy commodity industry, such as alcohol companies, for example, are coming forward to support relief activities by facilitating access to service or essential medicines and partnering with multiple stakeholders. And there is an important role of civil society to stress on accountability as a key pillar in terms of delivering UHC and NCD related interventions during the COVID era. So I think building on what Daniela was saying at the start of the call. And then as you said, CSOs through CSAM should be present in communities to rectify distortions on COVID pandemics, as CSAM is community-based. Thanks, Lizzie.
Yeah, thank you. So we have about 7 minutes. I see Alessandra has a hand up, so I'm just going to give the mic to Alessandra. Go ahead.
Thank you, everybody. I hope you can hear me well.
Perfect.
I represent Humanity and Inclusion, and we work on inclusion and disability globally. And I wanted to make a couple of comments on question number 3, on how we are framing our COVID-19 advocacy. Considering our focus on disability and inclusion, we have been promoting specifically advocacy actions to promote a disability inclusive response to COVID-19. To be able to do so, we have decided not to go alone, but to join forces with the International Disability and Development Consortium and the International Disability Alliance, which represent globally several disability-focused civil society organizations and organizations of persons with disabilities worldwide. Together, we are monitoring the impact of COVID-19 on persons with disabilities and using this evidence to strengthen the COVID-19 response and recovery. And this is also our strategy, IDDC and IDA strategy, not HI specifically, to fill the gap and react to the challenges that organizations of persons with disabilities are currently facing when they try and they are aiming to have their voice heard with their government or at the country, at the global level. And throughout the weeks, we have been submitting several inputs also to WHO to make sure that their response and their strategy to COVID-19 is disability inclusive. And I have collected from them comments to the call for action that you have published and for which we are together today. And I will be happy to share it by email because I'm cautious of time and I want to make sure that the voice of IDA and IDDC and the HI that I represent here today can be heard properly. But I want to take the last 30 seconds to make compliments to the organization today and to having the sign language service available for this, because this is a tangible action on how disability and inclusion can be really taken into consideration when we work on COVID-19. So thanks again for taking this initiative, and I will be sharing my additional comments on the call for action in writing.
Thank you so much, Alessandra. Katie and Johannes, are there any other comments in the chat that have come through?
I think Lizzie said that she's been trying to raise her hand.
Sorry, Lizzie. Let me just try to find you so I can unmute you. Go ahead, Lizzie. That we can hear you loud and clear.
Yes, I'm Lizzie from Nigeria, from Nigerian Women Association. We deal with the communities and on nutrition.
Just a little bit louder, Lizzie. Sorry, just a little bit louder so the interpreters can hear you.
Okay. So I have an issue. Our communities where the civil society has been present is distorted because the government went in and didn't go with us. We need to be on ground because CSM and UHC is about the community. Our primary health centers are not working because people are not confident in going there. And if you go there, there's no treatment ongoing. So we are asking that CCM should speak to WHO of the need that civil society should go back to the communities where we work, so that as the government is working and we are working with them, apart from making sure that there's a transparency, we will also make the government be accepted by the communities, and things will get better. Presently, the situation is getting out of hand, and we are sitting and watching. It's not good. Please, can we do something about it? Thank you.
Thank you, Lizzie. So Johannes and Katie, since we only have about a minute and a half left, maybe we can start with some closing remarks.
Thanks, Eliana. Yeah, I think what Peter has put in the box is potentially a useful closing point in terms of COVID has given us this opportunity as it lays bare the cracks in our health systems, and we can take advantage of that and fill the gaps. And I think everyone has rightly raised, the challenges that particularly in terms of civil society and community engagement, in terms of how COVID is affecting certain groups. And huge thanks to everyone for all of those comments and additions to the draft calls to action. But also, I think that framing in terms of this opportunity to build back better, and how COVID has highlighted so clearly what happens when you don't invest in health systems around the world, and gives us this broad call to action in terms of investing in efforts towards achieving universal health coverage and and building strong, resilient health systems that are able to respond to global health emergencies, as we've got in the calls to action. But yeah, I just think huge thanks from my perspective to everyone who's participated, and for the huge amount of comments and inputs, which we'll now take away. We welcome any more details email, but we'll be taking away everything in the chat box, and I've been jotting down notes as well, and trying to fill out the calls to action based on those gaps that you've identified. So huge thanks to everyone for taking the time today and for all of your comments. Johannes, over to you.
Yeah, not much to add, just also say a big thank you to all your contributions. And you'll see on the slide now the kind of the email address to which you are invited to send your comments and suggestions. So it's csm@msh.org. Please also look at our website and follow us on Twitter. We'll be good to connect it in various ways. And just to say, I think we have gone some way in kind of at least getting acknowledgement from political leaders that civil society inclusion is necessary and steps need to be taken. But I think there's now another kind of quite long way from translating these commitments and this messaging into really implementing and put them into practice. So you can be sure we will work on this, and we count on all of you to make sure that civil society becomes a real intrinsic and important part of COVID-19 response work, and to work towards achieving universal health coverage more broadly.
Thank you. And I just will thank the speakers, Johannes and Katie, thank you very much. And also the interpreters, thank you so much for the wonderful interpretation that we received today. So have a good afternoon, evening, and good night, everyone.
And obviously, huge thanks to you, Eliana, as well, for your work in bringing it together and organising the webinar.
Thank you. Bye, everybody.
Thanks, everyone.